Although brain tumors are rare, it's important to know the warning signs and treatment options. On today's show, we're going to answer your questions and offer you important information on what you need to know about brain tumors. That's all coming up on this episode of Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, everyone, and welcome to Ask the Doc. No appointment needed. The show where your questions are answered by our doctors and medical experts. I'm Olga Villaverde, and today I'm joined by a very special guest, Dr. Evan Bander. He is Chief of Endoscopic Skull Base Surgery at the Miami Neuroscience Institute, also part of Baptist Health, South Florida. Dr. Bander, thanks so much for joining us today.
Thank you, Olga. I'm happy to be here.
All right, so let's get to our first question, and it comes from Ryan. This is what he emailed us, and here it is. How common are brain tumors? Which ones are treated the most often? This is a question I'm sure you get a lot, doctor, but before we answer it, I want to show our viewers a quick video about brain tumors, and then we'll get to that question. Take a look.
The most common brain tumor is actually what's called a meningioma, which is a tumor that arises not in the brain itself, but it arises from the lining that surrounds the brain, the meninges.
Meningiomas are slow-growing tumors. Surgery may be suggested based on size and location.
Most meningiomas are benign, and after surgery they may never regrow, or if they do, it may take a very long time.
Dr. Wendy Sherman says another type of brain tumor is cancerous and fast-growing.
Glioblastoma is the most common type of malignant tumor in the brain.
After diagnosis, treatment usually starts with surgery.
First step is to remove as much of it as you can.
Treatments may slow the growth, but there is no cure for glioblastoma.
That's the reason why we are so dedicated to our research efforts to find innovative treatments for this and eventually a cure so that we can change the landscape for that. And that's actively happening as we speak.
For the Mayo Clinic News Network, I'm Joel Streed.
Okay, a short video there, Doc. If you could just kind of fill in the blanks in terms of which ones are more serious and what brain tumors we should be concerned about.
Yeah, that's a great question, Ryan. You know, there are actually over 100 different types of brain tumors that are diagnosed. But really try to simplify this, we separate these brain tumors into either benign tumors or malignant tumors. And so what does that exactly mean? Benign tumors are basically tumors that are slower growing. They are less likely to infiltrate into the brain around it and more likely to be well encapsulated, and often are treated, once treated, they are less likely to recur. Malignant tumors, on the other hand, are more aggressive. They often infiltrate into the brain around them and are faster growing and have a higher rate of recurrence. So that's how we sort of separate into malignant and benign tumors. And about a third of primary brain tumors are a malignant type of brain tumor, and about 2/3 are benign tumors. So I think the question that Ryan's getting at is, you know, how common are these brain tumors? And actually, brain tumors are relatively rare diagnosis. The data suggests that from birth, patients or the population in the US has about a 0.6% rate of diagnosis of a primary malignant brain tumor. So they're relatively rare when you compare them to other cancer diagnoses, such as breast cancer or prostate cancer, which have rates of diagnosis close to 1 in 8 patients. So on the scale of things, brain tumors are rare, but that being said, they can be quite serious. So malignant brain tumors, the most common are actually tumors that come from elsewhere in the body, what we call secondary malignant brain tumors, which are brain metastases from other cancers. And then the most common primary brain tumor is what's called a glioma or a diffuse astrocytoma, also sometimes known as glioblastoma. And there are about 17,000 cases newly diagnosed per year. And then in terms of the benign brain tumors, these are most commonly meningiomas, as you heard in the video, tumors that come from the lining of the brain, and about 40,000 meningiomas are diagnosed per year. And then that's followed by pituitary adenomas, which are tumors that occur at the base of the skull in the pituitary gland, and there are about 14,000 new cases of pituitary adenomas per year. Now, both benign and malignant tumors can need to be treated, so it's important to say that even though they may be benign, benign brain tumors can still require treatment.
All right, doctor, great. And we have more questions coming in. This is obviously a topic that our viewers are very interested in. Our next question comes from Aaron, and this is what they write. That video sheds some light, but do we know why some people get brain tumors? Is one group more likely than others? Doctor?
Another great question, and it's probably one of the most frequent questions I get when a patient has a brain tumor diagnosis is, why did this happen? Is there something that I could have done? And the unfortunate and sort of unsatisfying answer is that we don't know, and most brain tumors are actually sporadic with no identifiable cause. There's a very small subset of brain tumors that can be related to familial genetics, conditions such as neurofibromatosis or Li-Fraumeni syndrome. However, that really accounts for a very small subset of brain tumors. The factors that we do know increase risk for brain tumors are ionizing radiation, high doses of radiation. That is probably the most well-known risk factor for brain tumors. And then age. As patients get older, we do know that genetic mutations can accumulate in our cells, and as patients age, there's increased risk of brain tumors. And then in meningiomas, the tumors that come from the lining of the brain, we do know that these are more frequently seen in women compared to men in about 2-to-1 ratio, but they do occur in both. And that's somewhat due to the fact that these meningiomas can have receptors for hormones such as progesterone. And we can see that patients who have or are on hormone replacement therapy with high dose synthetic progestins can have somewhat higher risk of developing meningiomas, and meningiomas can grow faster during pregnancy. But really, those are the few factors that we do know about.
All right, let's go now to Esther, and this is what she writes in, doctor. 2 people I know have recently been diagnosed with brain tumors. Are you seeing an uptick in brain tumor diagnoses? And if so, why do you think that is? I'm going to be honest, doctor, I feel like I'm hearing more and more about glioblastomas. I'm not sure if it's because my brother passed away from one, but ever since he passed away, I feel like I'm even hearing more, even though you just started the show saying it's very rare.
Yeah. Again, this is a very common question that we get. And the fact is that there has been some data looking at this. The Center for Brain Tumor Registry in the US has looked, and there is no statistically significant increase in the rate of diagnosis of gliomas that we know of, although this is something that we're constantly reassessing. But one thing that we have seen actually is there is a known increase in the rate of diagnosis of these benign brain tumors, of meningiomas and pituitary adenomas. And that actually may be due to just better diagnosis. Our imaging has significantly improved over time. Our ability to diagnose these even at smaller sizes has improved. And so what we're seeing may actually be an increase in diagnosis of tumors at smaller sizes and earlier for these benign brain tumors. But in terms of the malignancies like glioblastoma, unfortunately, or fortunately, we haven't seen any significant change in the rate of these diagnoses.
All right, thank you, doctor. By the way, we still have time to answer your questions, and it's so easy to do it. Check it out.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, doctor, let's get to a question now from Raul, and he reached out on Instagram. Here's his question to us. Can you talk about clinical trials that are currently out there? My aunt was diagnosed with a brain tumor recently, and I am praying for her recovery. Hopefully, Raul, she will get a great clinical trial out there. Doctor, any information on that?
I wish the best to Raul's aunt. And in terms of the clinical trials, there is a lot of excitement in brain tumor therapy. We have seen many clinical trials in the last decade, especially given the fact that we've gotten a lot better at understanding the genetics and the molecular mutations that are underlying many of the tumors that we see. And so that has led to an increase in the number of clinical trials and opportunities for patients. In particular, patients with brain metastases or tumors that spread from elsewhere in the body, we've seen a significant improvement in patient survival due to drugs that are targeting the molecular or genetic mutations underlying these tumors. And in addition, in gliomas, we've seen in the last about 10 years a better understanding of the genetics and identification of a mutation called isocitrate dehydrogenase, or IDH, which actually now just led to a new FDA-approved drug targeting these gliomas particularly. And so there are a lot of other clinical trials going on in addition to sort of the genetic targeted therapies. There's immunotherapies that are being tested in many different brain tumor types, targeting and trying to activate our innate immune system. And then there's also a lot of excitement in terms of trying to improve the delivery of drugs into the brain. We know that the brain can have difficulty having drugs pass through the blood-brain barrier because of the unique blood-brain barrier can prevent drugs from passing through. And so there's been a lot of trials now focusing on things like focused ultrasound to try to improve delivery of drugs into the brain and direct delivery of drugs into the brain.
And that's something that I obviously recently learned through my brother's diagnosis. And if you could just explain that a little bit more, because a lot of people don't understand that we do have that blood-brain barrier. Because I would always say to the doctor, well, let's just treat it. And he would say, well, we're doing the best we can, but unfortunately, it's the only part of the body where the brain is actually protected by something surrounding it. And that would be so frustrating for me. Can you just dive in a little bit more on that?
Yeah, well, so the brain, unlike other parts of the body, the cells that make up the blood vessels of the brain have these junctions that prevent many molecules and especially drugs from getting through into the brain. And in many ways, that protects the brain from multiple infections, etc. But it can also make it much harder to deliver therapeutic drugs to the brain. So things like antibodies that may work very well in the rest of our body can't actually pass into the brain due to that blood-brain barrier. So actually there's a lot of excitement using focused ultrasound or other techniques to try to open the blood-brain barrier to allow these drugs to get in. And so that's a focus of some major clinical trials right now.
Very helpful there. All right, thank you, doctor. Let's go now to Victor. He has a question regarding his wife, I believe, and here it is. My wife is 48 years old and has been complaining about headaches for a while now. Is that a typical symptom of a brain tumor? I'm getting nervous. Oh, doctor, let's help Victor out. Any reason for concern here?
You know, Victor, what I would say is that headaches are actually one of the most common things that we experience. About 40% or more of the population does experience headaches. And what I would say is, again, the diagnosis of brain tumors is quite rare. Again, 0.6% chance. So the fact is that most patients who experience headaches do not have a brain tumor. So I'd like to comfort you in that. The fact is that I do think this is a good opportunity to talk about some red flag symptoms of headaches, though. So headaches that are severe onset, sudden onset thunderclap headaches, or headaches that are associated with focal neurologic deficits, weakness, numbness, speech difficulty, vision changes. Those are headaches that should prompt you to seek out care from your physician to explore these in more detail.
Thank you, doctor. Next question is coming in from Sienna, and this is what she writes, doctor. Let's take a look. My uncle is undergoing testing now, and the doctor has alluded to a brain tumor. Can you talk a little about the treatment options available for him and other patients? That's a great question. I know, again, with my brother, we looked into a lot of opportunities, options, and although unfortunately it didn't end the way we would have liked, we were very encouraged on what there was today.
Yeah, I think, Sienna, the treatment options for brain tumors, there are a variety, and really it all starts with diagnosis from the MRI. Determining what this tumor looks like on the MRI can help determine what the treatment course is going to be. In many patients, you know, if we find a tumor that's small, asymptomatic, and appears benign on an MRI, we may be able to start with just observation, repeating serial scans to make sure the tumor is not growing. That being said, if there are more concerning features on an MRI that suggest a more malignant tumor, or if the tumor is causing symptoms or pressure on important vital structures, surgery may be indicated to take out the tumor and to remove it as much as possible. And that surgery may involve a small biopsy, or it may be a resection of the tumor through what we call a craniotomy, where we temporarily remove part of the bone to take out the tumor and then replace it after surgery. Now, surgery is often followed by other treatments, whether that's serial imaging, observation over time, or may involve radiation or chemotherapy, depending on the ultimate pathology of the tumor. You know, every patient is different. Every patient has different goals of care, and that's really important. What we focus on is patient-centered care to make sure that the patient is being treated in the way that they want to be treated, and so they understand all of their options, whatever those may be.
Thank you, doctor. Thanks for explaining that. By the way, to our viewers, please note that if you don't get your answers today from all those beautiful questions you're sending, you can also go to our website and just click on Ask Hanna, where nurses are actually available. Take a look.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
Really is a great tool, so check it out. Okay, doctor, we're going to hear now from Jorge, and he has a question that I think many of us have asked. So here we go. I'm on the cell phone for hours at a time, and I'm not comfortable with earbuds, so I keep the phone close to my ear. Am I more at risk for a brain tumor, or is that a myth? That, doctor, I'm sure you get that question 80,000 times a day.
Yeah, it's actually probably one of the most common questions, and often actually one of the most common myths we try to dispel. So Jorge, what I would say is that cell phones are safe to use. There have been a number of epidemiologic studies looking at the frequency and rate of diagnosis of brain tumors, and we have not seen any link to cell phone use with brain tumor diagnoses. You know, what I would say is that physiologically, it actually doesn't make sense for a cell phone to be increasing the rate of brain tumors, because if they were affecting the areas that we were using our cell phones, we would probably see more tumors in the skin of the area the area near our cell phone use. So we don't see that, and we don't see any increase in the rate of brain tumors either.
All right, thanks so much, doctor. I'm so happy you clarified that. Let's keep it going. We've got one now from Charlie, and this is what they write to Ask the Doc. Dr. Bander, please tell me about how you care for people with brain tumors at your institution. I'm watching today because my sister was just diagnosed with a brain tumor, and I want to learn more. Of course, doctor, it also depends on what kind of brain tumor, but it's still a good question. And Charlie, we're thinking of you for your sister.
Yeah, Charlie, I'm sorry to hear about the diagnosis, but what I would say is that here at Miami Neuroscience Institute and Miami Cancer Institute, the focus on our care is, again, patient-centered, multidisciplinary care. So I think what's most important is that patients hear from multiple specialties. You know, our M&I, Miami Neuroscience Institute, and Miami Cancer Institute bring together experts in neurosurgery and neuro-oncology, in radiation oncology, and all of these experts review cases in our multidisciplinary tumor boards and bring their expertise to the patient to try to get them the treatment that they need. You know, we have, as neurosurgeons, have experience, and we use the most modern techniques such as awake intraoperative neuromonitoring and mapping. We use fluorescent guided surgery, 3D neuronavigation, endoscopes, exoscopes, microscopes. We use everything at our disposal to try to minimize the functional impact on our patients and to get them the best outcome as possible.
Thank you, doctor. All right, we still have time to answer your questions. It's so easy, and here's how.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, just got a question in from Stephanie, doctor, and this is from our Facebook page, and this is what Stephanie writes. This is a scary topic. Is there anything I can do to reduce my risk of brain tumors? I completely understand. It is scary, but again, one thing, if you could reiterate, doctor, is how rare this is.
Yeah, I think again, Stephanie, this is an important topic, and what I would say, the brain tumor diagnosis is extremely rare, and what we know is that there are no factors that you can necessarily modify to decrease your risk of brain tumors. Living a healthy life is important in general, but there's nothing specific that we can do to reduce our brain tumor risk.
I remember my nephews would ask me if there was any hereditary component regarding their father's glioblastoma, again, the most malignant brain tumor. And doctors were telling me to tell them not to worry because, again, the hereditary component wasn't there. Could you just amplify a little bit on that?
Right. So as I mentioned, the most brain tumors, particularly glioblastoma, there are not familial genetic relations for these brain tumors. There's a very small subset of population where that is the case. And in those families, there have been a history of multiple family members with those diagnoses already. But in general, these are sporadic. They occur, without cause, and there's really nothing that we know other than radiation exposure that increases the risk.
Thank you, doctor. All right, we got a question now from Alyssa, and she joined us via email. Thanks, Alyssa. This is her question. Is there a relationship between stress and brain tumors? What about stress and cancer overall? Well, that's a loaded question, considering we're stressed out every day in this country, doctor. What are your thoughts?
Absolutely. Stress is an inherent part of our lives and unfortunately unavoidable for most of us. What I would say is that chronic stress, what we know is that it's not great for our bodies in general. It can be immunosuppressive, but there's really, again, no clear risk of, or no clear link to a diagnosis of cancer related to stress. No direct link.
All right, thank you, doctor. This next question comes in from Nick, and it's our YouTube question. And I'm sorry, Nick, I actually kind of asked the same question, but doctor, I think we can follow up. Are brain tumors hereditary? I was told my great-grandfather had a brain tumor, but I'm not sure about other family members. I know we touched upon it. I'm just gonna add, Nick, if you don't mind, since you kind of spoke about the hereditary component, if there is any, is it just bad luck? Is it a disease of broken genes?
So, brain tumors we do know have genetic mutations and abnormalities present in the cells. And that's what we're targeting with many of our new novel therapies. That being said, many of these mutations are occurring over time, that our cells accumulate mutations just sort of normally over time as we age. So there's no necessary genetic link between those mutations. While some mutations can be inherited, most of these brain tumors are not because of those inherited mutations.
Thank you, doctor. Next, we're going to hear from Bill, and he just asked right now, I've heard the term tumor grades with other cancers. Can you explain what that means and if that applies to brain tumors as well? Good question there, Bill. Thank you.
Yeah, that's a great question. So tumor grades in brain tumors really has to do with how the tumor appears under the microscope to our pathologists. It has to do with how aggressive the tumor appears. Now, in many other cancers, we look at staging. Has the tumor spread to other parts of our body, or is it localized to one area? In brain tumors, we don't actually see much spread outside of the brain, so we look primarily at grading of the tumor. So how does it look under the microscope? Are there features of the tumor where it's infiltrative into normal areas of the brain? Are there features of the tumor that show that it's replicating very quickly? Are there features of the tumor that suggest more aggressive features are more likely to recur after surgery? And then now in the last decade, we've also integrated a lot of molecular and genetic mutations into our grading analysis. And because we're seeing so much increase in knowledge and our understanding of the molecular and genetics of tumors, we're actually able to better prognosticate using those tools as well.
Great information, doctor. All right, we've got about a minute left in the show. Thanks to our viewers sending in those questions. I thought maybe, doctor, in 40 seconds, a recap in case someone's just joining us regarding brain tumors. Again, they're scary when you hear about it, but I think one of the key things I wrote down is 0.6%. It's rare.
Yes. I think, it is a scary topic, and that's why it's really important to have a great team of physicians that are working with you and on behalf of you when you do have these diagnoses. Brain tumors are rare. Brain tumors can be scary. Some can be treated, with observation, others with surgery. Just have a good team on your side of physicians.
Thank you so much, Doctor. Truly appreciate your time, and thank you so much for what you do.
Thank you so much for having me.
Unfortunately, that's all the time we have today. Again, thanks to Dr. Bander. Thanks to all of you for your questions. I'm Olga Biaverdi. We're going to see you next time right here on Ask the Doc. Remember, no appointment needed. Thanks for watching. See you later.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.